what we do are looking at how we get our athletes back to play. And who we serve is important. And that's who all of us serve, whether we're the physician or we're the athletic trainer. We serve the athlete and the parents at the collegiate level. At the high school level, it's a little bit different at the pro level. I think it's less of the parents and it's more of the agent. But at least in the collegiate level, for the most part, except for the freshman basketball players at Kentucky, you're dealing with the parents and not the agents. So the trainer, of course, and that's where I just think that we have a great relationship, and it's so fun to work with great trainers. And there's my colleague, Dr. Podar, with the helmet of one of the guys who has concussion, talking with the athletic trainer. He's from Kentucky, and he came back after being at Colorado. Coaches are very important, just as we do all of our things. It's great to have that good communication, and it helps when you have a good relationship with the coach. Of course, then the athletic department of the university is very important, and it's interesting. Everybody wants to be number one. Everybody wants to be the most important, except for the athletic trainer. You athletic trainers are the most selfless, unrewarded people that I know of, and work so hard. And everybody else wants to be number one except for you guys. But we all know that the athlete's number one. And that's who we're really treating. That's why we're doing what we're doing. And everybody else, we got to make them feel like they're number one, but really, who we really treat is the athlete. So, in our role, we support, we encourage, we need to have enthusiasm in what we do, and that's important because the athletes have to understand that, have to have that relationship, and we have to, even if we're having a bad day or we're not feeling like it, as an athletic trainer, as a doc, we still got to be enthusiastic, and we can't bring anything else into the trainer and what we do. We've got to be uplifting to these guys who are hurting, who are going through maybe some depression because they've had a season-ending injury. So again, are we a team surgeon, myself, Scott, Christian, Dr. Ireland, or are we a team physician? And really, in what we do mainly, we're really a team physician. Athletes notice we're their advocate. We have to show them that we care, and we have to show them that we're willing to fight for them and for what their injury may be, or for whatever issue that they may have. And then we have to show them that we've got heart and we're in the game with them, no matter what. So it's important to be present. It's important for us to be around to establish those relationships, the trust, the comfort that comes in a comfort level. And if we're not around, they don't know who we are, and we just show up on game day, then that's tough. So we need to be around the training room, around the teams. We have to know the sport. Since coming to the University of Colorado, and we also take care of the University of Denver, and Denver has a great hockey and lacrosse team. I've had to cover those and get to know those sports, which I didn't know so well growing up. It's been fun, but getting around that has been really interesting, and that's important. We might see the injuries, and hopefully we stay off the field. But it's important to be around and be present for the times that the injuries do occur, or we do have to go on the field. And communication, as we know, we've got to have great communication. It's important to know people's names. It's easy to know the star's names, or the star wide receiver, or point guard, but if you start with the second team and then work your way up, you're going to be a lot better for it. It's important that we have communication with the parents. We do work in a different area now where there are HIPAA rules, and we have all our athletes sign something at the beginning of the year. 98% of our athletes, 98% want the parents called. There's occasional one that may not have a relationship with their parent or may not want the parent called. The trainer is usually present when we're talking with our athletes. If not, we talk to the trainer next. And some of this has to do with surgery. Take care of the athlete. First I got to call the parent, then I got to call the trainer and let them know how it went, and then the coach. And sometimes the trainer wants to have that communication with the coach, but often I'll either call or text our coach and let them know how the surgery went. The information needs to flow in all directions. If we don't, we might have problems like dropping somebody off the OR table. But the communication is not just one way. It goes in many directions, and that we have to remember as a team position. We have to involve others, and particularly the athletic trainers who are in the trenches all the time. We have to involve the other docs, coaches. We have a great relationship. I have a great relationship with the primary care docs at our institution, and I think that's very important too. And I think that really helps for a good team when you can have everybody working together. I've got to think about how would we treat our family member if we're in the same situation. The trainer and staff, I can't say enough about the athletic trainers. You guys work long hours. You don't get paid much. And the most important thing that you guys really want is respect. Again, you don't want to be number one. You just want to be acknowledged for the hard work that you do, and you do hard work. Little things count. You got to understand your situation, what you do as athletic trainers. Coaches are very demanding. Athletes can be very demanding, and those are long days. So we appreciate what you guys do. I know any of the docs that work with athletic trainers on the sidelines, and we see what you do. We really appreciate what you do. Now, MRIs are like Hallmark cards, and I got this from Kerry Windler, who's the doc at University of Texas, and he said basically they're like Hallmark cards because if we order one, it shows the coach and the parents that we care. And you guys have all been there. That you don't necessarily think an MRI may be necessary in some of these athletes, but enough times you get the MRI, and all of a sudden the athlete just feels so much better that they're getting an MRI, or the parents feel so much better. And oftentimes the MRI is negative, but they feel great because they know that this MRI, the magic MRI, was ordered, and they got it, and it helped resolve their angst about the situation, even though you knew what was going on and you knew what was happening. We like to get it at any time of the day if we can. We have block time on Sundays, so after Saturday games we can get it. I think that's important. If you're in the NFL, you might get it that same night. We've even got it some nights that same evening if we can get the tech in. And it's an important thing, so I don't want to downplay the importance of the MRI and getting that, and not so much even for the diagnosis of it or the diagnostic use of it, but more for the how it's perceived by the athlete, the coach, and the parents. Return to play, we all deal with that. It sounds pretty simple, but it's in reality sometimes very complex. We have to have the correct diagnosis, and that certainly means physical exams, sometimes looking at x-rays on the sideline. We want to determine the best treatment, and safety is of the utmost importance. Of course, then we've got to look at different factors too that come into play with return to play, and that's sometimes the athlete's mental toughness. And we see that come into play quite often. And there are times that we really have to rely on the athletic trainer who has experience and understands the mental aspect of this athlete and understand what this athlete can or can't do mentally, even though physically they may be able to. We just function as the determinator, and we look at all these factors, but eventually, with help from all the factors, as a team physician, we make the final call as to who can get back out there and play. So in those lessons as a sidelines and a team physician, we surround ourselves with good people. Very important to have a great team. Sometimes I need to lead, and sometimes I need to follow, but whatever I do need to be a team player. We can learn from each other. Everybody can learn from each other, and keep an open mind, because I think some of the best ideas come from those who are around us all the time, and the athletic trainers or the fellows that we work with, they got some great ideas, so just get to be open-minded to what they have to say. And so we know that there are no absolutes in what we do. It's really, it's not a black or white, except there is one, and we're on those sidelines. And the welfare of the athlete is your absolute responsibility, and that is an absolute. So in summary, with this, and then I've got, really this is the first part of what I want to talk about. Sports medicine, the focus is not on surgery, even though as orthopedic surgeons, the ones of us that are, we like to think that sometimes it is, and we really like doing it, but it's really not what we do as a team physician. Communications skills are of the utmost importance. You've got to know the players. You've got to know the players and the players of who is involved, and that involves the athletes, the coaches, the administrators. The athlete is the #1 priority, and we really have a chance to make an impact, and that's just not as a team physician, but the athletic trainers and all those that are involved in healthcare. So these are the teams that we take care of: University of Colorado and University of Denver. And so what I've got now just a lot of different pictures from the years of being on the sidelines, and you'll see some of these things are pretty interesting. This is what it looks like coming out the tunnel. This is at a Big 12 championship game, and you know, Doc, I usually one of the last ones, just kind of wander out, but you know, we get a lot of questions asked. What's it like to run behind Ralphie? That's our mascot. So you can see this is the pen that Ralphie, our buffalo, is coming out. And so they open up the pen. They got 6 guys that are holding on to it, and the team goes running behind Ralphie. So that's what it's like to run behind this, you know, this 800, 900 pound animal that is actually pretty fast, and you don't want to get run over. It's a pretty cool mascot if you ever have a chance to see it. This is at one of our away games, and you can see it was a hot day, and we've got all these IV bags ready to go. And it's interesting. This picture was taken about 10 years ago, and we've really decreased the amount of IVs that we've given for a number of reasons. I think we manage our fluids much better leading up to the game, manage our electrolytes, salt intake, and so we don't nearly have that. But this was down in, I think we were playing Florida State, and we had a hot day, and the guys from Colorado weren't used to it. You know, injections, you can see he's really happy about getting that injection before the game for the AC joint. And this poor guy had 2 AC joint injections and IV all at the same time. You can see that all of us working on getting the shots in. You know, day before a game is always interesting. Before a football game, the big band will travel across the country or to wherever you're playing with all the equipment. And so that goes to where you're going. And on the day of the game, you got to travel to the site. And this was interesting. This was when at Vanderbilt, we were driving from Atlanta, where we stayed the night before, to Athens. And it was a small 2-lane road. And as we were driving, this semi sideswiped our team bus, one of the team buses, and we were back a couple of vehicles, and we saw this commotion. We saw this semi jackknife and turn, and fortunately nobody was hurt. But you can see what happened. This thing, it came close to really causing some serious injuries. And as a team physician, we were right there, and we had to check all these guys for injuries and glass, and you can imagine what it did to the psyche of everybody before the game. You know, so you never know what you're going to encounter as an athletic trainer or as a doc. You got to be ready at all times. At the hotel, on the way to the game, on the airplane, wherever. So speaking of airplanes, this is what it used to be. We could drive the bus up and get right off onto the airplane, but now we got to go through the security. You got dogs, you got people checking your bags and wanting you. At least we can do that. We don't have to go through the main airport, but it's a lot different than it was 15 years ago prior to 9/11. We always get to these motorcycle escorts, and these guys put the Buffalo decal on their helmets, so we appreciate these guys from Louisiana when we were down there for a bowl game. the day before game's always interesting. You do a walkthrough, maybe you go with the team, and I always enjoyed it because I could go walk around the stadium, kind of see the environment of where we were playing, see the campus. Pre-game's always interesting, and here's some hockey guys. They're out playing hacky sack before a hockey game, kind of warming up, getting loose, and that ragtag bunch of cloth that you see on the left, that was the goalie's good luck shirt, and he had to wear it. He had a quite successful season. This was on their way to the national championship at University of Denver. But you can imagine, this is in the playoffs, and that thing smelled. I don't think he ever washed it, and it was so torn, but he had to wear it. So, our athletes just love having all their superstitions and everything that they do. We get to see some things that some people never get to see. The coaches talking before the game, the athletes in preparation, putting on the shoulder harness for shoulder instability. Here's the manager for the hockey team sharpening the blades before the game. There's so many different things behind the scenes that we're privy to that's really just fascinating in what goes on, and seeing how our athletes get ready for the game. You see this guy, he's got tattoos. He's looking at you and saying, "Why are you looking at me taking a picture?" And these guys are getting ready. They're getting ready for battle, and we're part of that in what we do. Of course, the taping, and sometimes you're stretching, and you're stretching wherever you can stretch. And this is underneath the bowels of the stadium in Missouri because the locker room is really small. Unfortunately, it was a good day, but this is where they had to stretch because they had no other place to go. And then sometimes you have a chance to talk to some players of the other team. This is Buster Scholl and myself. He's the primary care doc at Vanderbilt, and we knew this kid from the other team. He grew up in Nashville, so it was fun to talk to him before the game. And that time before the game is a nice time, to talk with the other team docs, like the guys from Oklahoma, and to talk with people that you see as kind of the calm before the storm. Nice to reestablish those connections. This is the coach at Texas that I knew from high school in Boulder. And I love this picture, and you guys will appreciate this too. You guys recognize the stadium there? That's University of Tennessee. And here's a typical Tennessee guy. He's got no teeth, and he's looking, and he's trying to make sure that the goalposts are level before the game. And I'm not sure if he quite got it, but he's sure smiling and chuckling, thinking he does. And I didn't even know that they did that before the game, but I was walking around the stadium and I saw this guy do it, and I just thought, I got to take a picture of that. So, and seriously, you don't see any teeth because he doesn't have any. This is interesting. This is at Florida State. This is on the Friday, our walkthrough before the game, and they got a guard on the mascot in the middle of the field, the painted mascot. They did not want anybody stepping on that or getting near that, and this guy was pretty adamant. So they got a guard on the mascot. It was really interesting that the extremes that some places take for what they do. Of course, you recognize that. It's Vanderbilt. That's about as many fans as we had in the stands at that time. That's kind of was the state of Vanderbilt back 10 years ago. It's a little different story nowadays. They're doing quite well. This is what it looks like, not from the sidelines, but at our stadium in Colorado on a nice evening in the fall. Of course, looking at the players, usually hanging out with the trainer, waiting, watching for something to happen. This is often the view, looking, trying to find a view through wherever you can. And then when you forget your rain jacket, this is what happens. I learned early on, but not until after this game, that you're supposed to bring a rain jacket to every game that you go to. So the next game that I had, I at least had that, and then I can even watch the game with an umbrella, as you see on the right. These are things that the team position we get to do. Now, you athletic trainers, you don't get an umbrella. You don't get the same luxury that we get. We get to get our hands warm. You guys recognize the stadium. It was always cold when we came to play here at UK because we were playing in late November, and And we always had the sideline heaters, and it was the other thing that we would do, the hydrocolator. We would always bring our cheese in the jar and put it in the hydrocolator, and made a great dip of nachos for after the game.